whole Affordable Care Act was based on the premise that anybody could get a subsidy. That was the whole argument in favor of it. But there is one line, essentially what supporters of the law say is a typographical error. And opponents of the law have used this one line to say, no, 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 you can only get subsidies from a state exchange, not from a federal exchange.
As Americans start to get a first peek at their premium prices under the Affordable Health Care Act for 2015, a new Senate prepares to take control and perhaps eviscerate the entire plan. It's easy to get rid of something, but what do you then put in its place? And what hardships will that bring down on a segment of Americans in desperate need for medical assistance and covered by Obamacare? All right, welcome to MidPoint. The Director of Health Policy at the Illinois Policy Institute, formerly a public policy consultant on federal and state health care programs, Naomi-Lopez-Bauman joins us. Naomi, thanks so much for being here.
Thank you for having me today.
Naomi, you're going to have to, first of all, make sure that everybody understands what's going on here, because if you go ahead and start looking at Supreme Court briefs, we could be here for a week and a half and people's eyes would glaze over. Give us in English, if you will, simple. King versus Burwell. What exactly did this do to change our way of thinking about Obamacare?
Well, King versus Burwell is just one of several cases making their way through the federal courts right now, challenging the Affordable Care Act. What the text of the law says is that IRS subsidies can flow into states that have established a state-based exchange, but the vast majority of states have not done so. And so the question is, should we be following the plain text of the law? And so the Supreme Court on Friday agreed to hear this particular legal challenge to the Affordable Care Act.
All right, now here's a couple of numbers here that I think we all need to understand. Section 1401, and please stop me if I'm getting this wrong, because I'm not an accountant or a Supreme Court justice. I just play one on TV. It says Section 1401 provides for tax credits for the purchase of qualifying health insurance plans in quote-unquote exchanges established by the state under Section 1311. Now, the government argues that the phrase established by the state doesn't mean the exchange actually has to be created by the state, because other provisions of it, to some degree, cover. Okay, I'm going to stop right there. Let me just stop right there at established by the state. Why is that then something that is a real problem for Obamacare moving forward?
So whenever the Affordable Care Act was passed, there were a couple of things that that the law did, and one of them was it basically told the states, you have to expand Medicaid or we will withdraw or revoke all of your Medicaid funding. And so that was one provision that was struck down previously by the Supreme Court. This section refers to the subsidies for people to purchase health insurance either through the federal exchange or through a state-based exchange. It's very clear in the law that there is a federal exchange and there are state-based exchanges. And so a lot of the states opted, in fact, the vast majority opted not to establish a state-based exchange. And part of the thinking and part of the ongoing debate about this law is
the fact that every now and then Skype may go ahead and freeze, which is exactly what it did right there. Okay, we're going to get her back in just a second. That's the way technicalese is here. Let me bring this up because the next question that I have for Naomi is very simply put, the fact of this moving forward with regard to actual language itself. There was an interesting article that came out just the other day from Forbes.com. Scott Gottlieb is the one who made this article, printed this article, I should say, authored it, if you will. And he points out here in his opinion that, and I quote, Obamacare was an exercise in legislative malpractice containing an almost historic number of major drafting errors. The law's invasive soul also means that its chaos and unanticipated consequences ends up touching almost every aspect of economic life. What we're dealing with here, and I think what Scott Gottlieb says, and I want to make sure that we ask Naomi about, is the fact that this is a law that no matter how often you look at it, no matter how many times you tear it apart, no matter how many times you have people say, wait a minute, it actually is good in essence, there are so many mistakes in Obamacare. And this would seem to be another one of those mistakes that eventually you're going to get caught on. And the government got caught on these. How many more? The Supreme Court is going to decide. Different courts will decide. Different lower courts will decide. But again, we're talking about a law that is so inherently flawed that perhaps, just perhaps, is it possible that the Obama administration and the people who put it together, and again, I'll try and be fair here, they put it together, let's shovel it out there, and then Let's see if somebody else can help us make it right. Maybe they can repair it for us, but meantime, we'll have pieces of the law that will be there that cannot be taken out, that cannot be changed, that cannot be removed. So maybe it's a plot. Ooh, what am I working into here? Conspiracies? No conspiracies here, but certainly a lot of things that have to be changed. Breaking Back with Naomi-Lopez-Bauman, we dig deeper into the not-so-easy questions about Obamacare right here on MidPoint.